Okay, as Susie, what was going through her head was being a comfort to Vivian. She had just thrown up, which is a painful, unpleasant experience, and Susie was trying to be sympathetic. She was trying to establish rapport. She was being attentive to her patient. She was showing interest in her patient's needs, in her, as she perceived loneliness because she commented on the lack of visitors. She was trying to, she did a good job coordinating the conversation so they were in sync on the patient's priorities. Susie was trying to find out if there was anything she needed, anything that she could provide. She touched her arm to provide some physical comfort as well as all that verbal communication of comfort.
So as for Dr. Kalikian, there were a few things that I noticed. One thing that could have been improved was just the fact that since he was leading the grand rounds, he didn't, when they walked into the room that Vivian was staying in, he didn't knock and he didn't ask for permission to enter or anything like that. And also he didn't even mention what was going on. He didn't mention, hey, we'll be doing grand rounds. Do we have permission to, have all of the fellows kind of observe while we go through the treatment options for you or anything like that? They just kind of barged right in and started to go. So that was definitely something that could have been improved. That really just didn't show that he, in general, just acknowledged her presence. That being said, there were a few other instances during the conversation where he did actually acknowledge her presence, which was great. For example, he kind of had a little bit of banter with her when he was challenging the residents to come to the conclusion that hair loss was one of the symptoms. He was kind of saying like, oh, why do we even bother, Dr. Baring? So he was kind of being a little playful with her there. And he did speak to her directly, which you don't really see too much with the other doctors that were there at the time. Yeah, so that's Dr. Kalikian.
And for Jason, he didn't initiate anything with Vivian, asking how she was, explaining to her what they were planning to do, and instead talked at her, and most times didn't even acknowledge her and just spoke to Dr. Kalikian or the other fellows. He also didn't ask for permission when disclosing her condition to the fellows, and didn't ask before performing the exam on her either. And at the very end of the scene, Jason has to be reminded by Dr. Kalikian to be clinical and actually acknowledge Vivian and thank her for her time. And during the entire exam, Jason's using very lofty and medical terminology and doesn't really check in to make sure that Vivian is understanding what he's saying, and instead just rolls right through his discussion about her.